one side.
It's alright, we're recording now anyway. So. Alright, so TAC Talk episode 4. I am joined by Kirsten and Florence.
Hello.
Tash, and then
Hi.
and Nat and Henry, who is smashing some milk at the minute. So today, this podcast, we're going to be talking about kind of like pregnancy and training around pregnancy and how it's affected these ladies in particular. So my first question, and you can kind of go off in any tangent you want, was how difficult was training or day-to-day activities such as like walking and stuff like that whilst you were pregnant? All right, so I'll go with you, Nat, first.
So for me, I had quite bad sickness until 16 weeks.
So early on.
Yeah. And I put too much stress on my body, so I didn't accept that things were a lot harder. And so I kept doing a lot of the training, and in the end, I got a antenatal specialist because I just thought I need to be told what to do safely and accept that my body's going to slow down, things are going to be harder. And it's a huge shift from, what you're used to, and then all of a sudden you're getting tired walking up the stairs, and it's like, why am I so tired? I don't know whether you found it. I'm really breathless, and then it's like, oh wait, my body's grown a human, that's why I'm breathless. So it took me a while to accept that things would slow down. But with the PT, I trained probably 2 or 3 times a week, and it slowly went from normal CrossFit to a lot less impact. And I did actually work out the day I had him. So a little 5 kilo dumbbells, just a little thing in the front room. But for me, it kept my mind a lot more positive, and I feel like being active through my pregnancy really helped with my labour. Yeah.
Did you find that so obviously kind of that day-to-day stuff got a little bit harder, you're getting out of breath quicker? Did you find it easier to control the training as compared to the day-to-day stuff? Was that more of a shock? Because the training's very you've got to go in and have a purpose to do it, and sometimes it is a little bit easier to just kind of say, oh, I'm going to scale it back, whereas if you got to run up the stairs for something and stuff like that, was that a little bit more difficult to? Yeah,
it was. I think, again, for me, it was the accepting that I couldn't lift what I wanted to. I couldn't run as far as I was. And for me as well, the tiredness was just
He definitely agrees.
Yeah. The tiredness for me was through the roof, but I did find that if I made myself do a scaled workout, I felt so much better afterwards, less lethargic than I would have before. By having kind of the everyday is tiring, but having the workout definitely helped. I think mentally and physically. Yeah.
How about you, Kirsten? Because every time I pop round for a dog walk with Bing, you were asleep.
Yeah, it was quite different to before. I think the fact that we were in lockdown made things easier. So it was much easier to take the pressure off yourself to do the training, to hit the same numbers, especially in the beginning when people don't know that you're pregnant. Had we been in the gym, I think I would have felt under pressure to carry on as normal.
It probably would have been more obvious because
exactly.
You were proper out of the blue.
Yeah.
when Tash showed me the picture and she said, "Oh, it's Kirsten," I was like, "Oh, was that Kirsten when she was a baby?" Like her scan. I was like, "That's a bit of a random picture to show us. Not that it was your actual baby." But,
yeah. So it was. Yeah. It was easy to hide, and it was easy just to chill out a bit for the first 12 weeks. It was also, the thing I found was that it was really hot last summer. And when we were training at home, there were a couple of days I just had to stop after about 5-10 minutes because I felt like my body temperature went soaring high, and it wasn't coming down, it wasn't recovering. So it was things like that really surprised me, and I had to kind of take it easy from then on. But generally I just tried to keep as active as possible throughout. Dog walks got harder, walking up hills got harder.
Yeah, I was going to say, because you're quite knowledgeable of your training and you're good at stepping back where you need to, and obviously using your numbers and stuff. Was that easy, in a way, oh, I need to scale back my training? Was that easy to do for you?
In some respects, in my head I thought I knew what I would be dropping at what points.
Yeah.
But I found that actually, for me, it worked differently. Like, I stopped snatching really early on because it just felt too close to your tummy and your pubic area. And although I didn't massively have a bump in my head, I just really didn't want to. Yeah. Whereas I was quite happy doing power cleans, even, you know, things like running for a little bit longer. But I mean, I've seen other people train, and Nat's trained, and, you know, other pregnant people, and everyone's done things slightly differently. Some people have been able to snatch up until the end, or carried on rowing till the end, but had to give up back squats really early. Whereas for me, back squats, I didn't even feel pregnant all the way up to like 36 weeks. I was, you know, it didn't really feel any different. So that was something I still really enjoyed. But yeah, I mean, it's never easy to scale. No. I mean, if you're a competitive person. But
how about for you, Tash? So
I think I've been quite lucky because I'm pre-baby still. Hang on, passing baby over. So I've kind of been quite lucky to get all the advice from these two. So I kind of did the same as Nat and went down the antenatal kind of program route, especially because we were in lockdown and I was struggling anyway.
Do you want to give a shout out to your antenatal?
Yes, Jenny Ely, amazing.
I'm sure the millions of people watching this will now sign up.
On Instagram. I think I struggled mostly because of lockdown at the beginning. I'm not a fan of training on my own, let alone doing CrossFit when it's on your own. So that was really helpful for me. And then we've got a very cute baby here. And then now I think I'm struggling more. So opposite to that, I've had really bad sickness now. So we were talking about this earlier when we Zak, where I can't really eat anymore. So
especially after a certain time in the day.
Yeah, so like especially in the afternoons, evenings. So I'm really struggling with energy now. So actually having the energy to do a workout is proving really difficult, and sometimes it's like a choice between whether I want to walk the dog or do a workout. So yeah, that's been a bit more tough towards the end for me.
Yeah.
So 34 weeks today, so we'll see how the next few weeks go.
Because I imagine for all three of you that, like, because you guys are all so active, like in the gym, and you know, you all get out and walk the dogs a lot, like not being able to do that stuff as well, like walking the dog and things like that, is a little bit harder because you don't see it as activity the same way as someone else might. Like for you, going to the gym and training is activity and exercise, but those things have got harder as well, those extra things like going for a walk. Like the other week we went for 2 dog walks in a day and you were like absolutely smashed and you were like, I don't know why, and I'm like, well, you have done 2 long walks kind of thing. And I think that's something not many people take into account, is the activity outside of the gym, I suppose.
I think we take it for granted that we can do that without really breaking a sweat, because I remember being heavily pregnant and going out for a kind of 2-hour walk and trying to keep up with Bing. And
that should be easy.
I mean, by the time I got home, I literally got straight in the bath because my hips were in agony. It was frustrating because a dog walk should be fine. It doesn't count as exercise in my head, so it was.
So that was what I was going to ask next. Actually, there's obviously the obvious physical factors of getting pregnant, like growing a baby and stuff like that. But was there anything in particular you noticed that had a kind of negative effect on you? Like you just said about your hips, was like, I don't know, your ankles or your knees or back or anything like that?
So for me, pregnancy treated me very nicely.
Yeah.
I didn't get swelling. I didn't get swelling. I didn't get kind of any of that. But for me, it was the pressure towards kind of 36 weeks onwards. This might be a bit too much information, but the pressure like on my pelvis was just unbelievable.
Really?
Like I'd go for walks and and it would be, rather than walking kind of 6k, it would be a 3k walk, simply because it felt like something was going to fall out.
You just kind of found yourself having to stop.
Yeah.
Was that as a result of doing stuff like walking, or was that just was that how you felt, kind of thing?
I think it was a bit, but I became towards the end a bit of a one-trick pony, like you were saying. It was having to choose, you know, a dog walk or so I was pregnant in the really savage first lockdown where you could only do 1 walk a day.
Yeah.
And it was kind of yeah, for me it was my pelvis and just the bottom of my bump. If I was standing or walking for too long, I could really feel that, and it was having to accept that some days I just had to sit down when I was tired, and then I would get really like frustrated with myself because I felt like I was wasting the day.
Really listen to your body, kind of thing.
Yeah, and I'm not very good at that.
No, I don't think many people are who go to the gym.
No.
Like, so, well, what about you, Tash? Like,
yeah, same really. I think just struggled every now and then with walking, like, you know, like every night we'll have to stop, or like I've got like my bump feels really tight, or
your back
yeah,
lit up, and also your rib. Like
yes,
recently.
I've got a really bad rib. But apparently there's some legs stuck under there, so I think that's why.
Kicking out of the rib.
Yeah. So yeah, sometimes just the pain gets a bit too much, and I think as well, like Nat said, just feeling like you're wasting a day. Like there's some days where I literally just do nothing and I'm like, oh my god, this is not me, like I need to take the dog out or do something, but actually it doesn't help.
No.
So yeah, just kind of try to listen to the body really.
What about you, Kirsten? Like,
I had the odd day where I had, you know, pelvic girdle pain or, you know, pain elsewhere, but generally it didn't last very long. I think the thing that stopped me in the end was close to kind of 36 weeks. I had really high blood pressure out of the blue, and then had to be put on medication for that. And I kind of felt like at that point, if my body was already kind of stressed and on medication, and the medication didn't make me feel very good, but with really high blood pressure, I probably shouldn't have been, you know, pushing myself in the gym. So from that point onwards, I didn't train up until the birth.
Because you were having to regularly get that checked, weren't you?
Yeah, there was kind of some anomalies early on that meant that I was being monitored, but I kind of expected it all to be fine, and I mean there's no history of high blood pressure in my family or anything like that, so, and as a kind of fit person you don't expect to be taken down by something like that, but
not with something like that,
it did. Look, I mean, again, fortunate timing, it was over Christmas, so I didn't feel too guilty not doing anything, but it did just force me to take the last few weeks off completely and just rest, which probably did me some good.
So what's quite big, obviously, with the kind of prenatal stage and exercises, pelvic floor exercises. Who did their pelvic floor exercises and who's been doing them? Because Kirsten, every time I've seen you, I was like, have you been doing your pelvic floor exercises? And you were like, I'm going to do it later, or something like that. So I don't know if you actually did.
Yeah. I mean, I saw a pelvic health physio, and I did do it sort of fairly early on in the pregnancy, and I did do it here and there, but nowhere near as 3 times a day as you're meant to do. And I think I was quite fortunate in some respects in that I ended up having a cesarean birth, so my pelvic floor isn't as damaged as maybe it could have been, but I am trying to do them again now, and kind of get it back to full strength, but no, I'm not very good at remembering.
Do you think if obviously, because throughout you're pregnant, we were probably in the gym for maybe 3 out of the 9 months, maybe about that time. So do you think if you had access to a gym for the whole duration, you would have found that a little bit easier to do, or do you just think you just don't like doing that kind of stuff?
I mean, it's like stretching. I'm not very good at that either. Warming up, cooling down. But potentially, I think if I'd have got myself into a routine of, like, you know, just lying on the floor and doing them at the end of a workout, then it probably would have lasted longer. Being at home, I'd do a workout and then immediately get distracted by putting some washing on, or, you know, making some food or something else, and I was like, I'll do it later on in the evening. I never did. So, but potentially, yeah, if I was back in the gym, I would try and do it at the end of a workout or the beginning of a workout and just spend a bit more time on it. But
what about you, Tash? Because obviously you've signed up to like yoga and Pilates, and as well as the program you're doing with Jenny, and has that helped you get it in without having to consciously do it?
Yeah, definitely. I think Jenny kind of programmed it in for a good couple of weeks right at the beginning, which I did religiously do. However, I haven't really done it I definitely haven't done it every day since, that kind of thing. But I did sign up to like a Pilates course with a lovely lady called Angela Jameson, and that incorporates a lot of pelvic floor work into that. So I'm at least doing it once a week with her. So that's been really good. But yeah, definitely not as much as I should have, and I'll probably regret it.
What about you, Nat?
So I ended up having to download an app to remember to do it.
Yeah.
But again, like Tash, so Jenny was really good at kind of progressing the pelvic floor stuff. So it would be on its own, then it would be whilst doing certain movements like a bridge, and it's, I don't know about you two, but like when you start to do your pelvic floor whilst you're doing something else, it's really hard. So you start with like just standing stuff, and then sitting, laying, bridges, and for me, I was astonished at how difficult it is to pull your pelvic floor whilst you're doing like glute holds.
Yeah, it is it's really tough. Even like when you get people with like lower back injuries to do stuff like that, it is really hard, and it's very humbling as well.
Yeah, and I think the difficult thing is, I mean, I've tried to keep it up because sadly I think in society it's deemed as normal to be incontinent once you give birth. You know, you see always adverts and it seems like it's normal to wee yourself, but actually post-birth I went to a women's physio, and very quickly they say, no, it's not normal for you to be weeing if you run or squat or anything like
Double
that.
unders.
Yeah, wet double unders. So I think sadly with society and like GPs saying it's normal,
it's kind of been accepted, and you don't really look to do that as the pelvic floor stuff as much.
Yeah, so then, you know, I've spoken to a couple of women and it's like, oh, what about your pelvic floor? And I've got a friend who's 10 years postpartum and she said, oh, I still have to use a pad when I run because I get caught out sometimes.
Oh, wow.
And I thought, but that's 10 years after birth, like that's not normal. So I do think pelvic floor strength is something that should be offered more.
Yeah, definitely advice on that.
Yeah. And having like had Jenny and the woman physio that I go to, it's opened up to me how much there is linked to pelvic floor.
Yeah.
And especially for me after birth, going from strengthening it before to after, it was so weak afterwards. What? Yeah, it was so weak. So now I have an app and I make sure at least in the mornings when I brush my teeth, that's the time when I always do pelvic
Like
floor.
little and often kind of thing. Okay.
Try and do it every day.
That's cool.
Yeah.
So obviously 2 of you have had your babies. Kirsten, you had a C-section. You had it in water.
Yes, in my front room.
Yeah, your front room. And obviously Tash, you're due next month.
Yeah.
I was really interested to speak to you, Kirsten, is obviously I want to say this past year, but because of COVID my timing's off. So probably in this past 2 years, from your competitive CrossFit point of view, you probably kind of got to the best you got, right? So like you qualified and competed in a sanctional event, you qualified for another sanctional event, and obviously it never happened because of COVID, and you competed at the European Championships. How is your like mentality going towards training? Because I know you, and I know you're super competitive, and you hate losing. You lose at most things. Right? I'm joking, but like, like, I suppose what I'm trying to say is it easy just to kind of accept that you're gonna be like you are where you are now due to what you've been through? Your body's been through a lot of trauma and stuff. Like, how are you approaching that mentally? Your training going forward?
I thought, to be honest, I'd find it harder than I did. I mean, she's 4 months today actually, and I'm kind of just getting fully back into the swing of things. And in my head it was going to be, you know, after 6 weeks I wanted to be, you know, doing this, that and the other, and by now I wanted to, you know, to be doing competitions. When I kind of look at it last year when I was pregnant, and we didn't realise we were going to be in another lockdown at this point, and things like the Premier Fitness competition in Oxford was going to happen in June, and I was thinking, oh, maybe that might be a good one to get back into, and thinking the fact that, you know, June is next month and I've only really been training for 4 weeks, it would have been tough, and I would have then put more pressure on myself. But I do think, again, the lockdown has been a real blessing for me in that I didn't really do much for the first 6 weeks, 8 weeks, because the most I did was walk the dog, and it really even some days that, you know, that was a struggle, especially wearing a carrier. You know, you don't realise at the time what pressure that puts on your core and your...
Especially on a long walk. Like,
yeah.
Didn't you do like a 19k walk?
Yeah.
Yeah.
Yeah, again. I mean, I regret these things afterwards sometimes, but again, walking in my head was just a walk. Yeah. But yeah, it is humbling. So I do want to get back to competing, but I haven't signed up to anything. You know, there's qualifiers going on at the moment, and kind of a month ago I was considering entering.
Yeah.
Because I think by September, October time, which is when the competitions are...
You think you'll be okay by
I
then?
think I'll be okay.
Yeah.
Probably not back to peak, and probably never will be, but at least kind of competition ready.
Yeah.
But I didn't sign up, and I'm glad I haven't, because I would have really struggled, especially with that first workout that's been going on. I hate rowing and burpees over the bar. But two, I think it's just the added pressure it would have piled on over this month, and I just want to focus on getting strong.
I suppose
doing it sensibly.
Even for you wanting to do it competitively, the most important thing is really getting back to enjoying it.
Yeah.
Just and obviously working out a routine with what works for you and Florence, and obviously bingo's here 75% of the time.
Yeah,
so
exactly.
but I suppose that's all really new. It's not just coming back from like kind of obviously your body going through that trauma. It's finding that kind of new routine, I suppose, that works for you as well. Yeah.
And it's not easy. I mean, she's exclusively breastfed, so I was in here, you know, earlier, but between training and doing this, I knew that I had to get home and feed her, because no one else can feed her at the moment, and then, you know, get her ready, trying to shove some food down me and go again. But you just Jim is
you were late for this podcast.
I wasn't bang on
2 minutes late.
But it definitely, you know, training is way down on the priority list, and if I'm too tired or if she's not happy, or then it doesn't matter if you miss a training session, which is different from before, because I was able to prioritise it above most things, including work some days. So.
Has that been easy to do, like mentally? Like, are you okay with that? So, like, say if you planned on training tonight, for example, and you couldn't because of whatever reason, are you like, you know, that's fine, I'm okay with that, or is it kind of nag on you a little bit?
No, I am okay with it if she's the reason.
Okay.
I mean,
if it was not Bing.
Exactly. If it was because Bing's been here chatting and he said he's going to be home by 6 and he wasn't, then I'd be annoyed that I didn't get him for my session.
Okay.
But, you know, if she suddenly has a complete meltdown or won't go to bed, then I take that a lot better. And I don't mind that way.
So Tash, I think I'll ask you the same question, because it'd be interesting if we ask like what you expect to do, and then see what actually happens, because like obviously everyone has that, this is what I plan to do. Like, how do you envisage, obviously, you know, you don't know how like the birth's going to go and stuff like that, but where do you kind of place training on your, I don't know, like your priority list? Like, is it like training in the gym is important, or is it going out, just walking, getting active and like that kind of stuff, or?
I think for me, probably just going out and being active. I think probably the past couple of years anyway, that's been my priority. Like I'm not as competitive person, I don't do as many competitions and stuff, so that's always kind of been like your thing.
When I can
also
walk
not
again.
the past 2 years. But anyway. So I think I'd like to come down here just to have a bit of like, you know, me time maybe, but I also really like yoga, so that's quite
it's kind of a bit of a new passion, isn't it?
Yeah, that's quite important to me as well, but I think I'd like to start with continuing with Jenny and that programme, and just making sure that I'm doing the right things, and then see how I get on with this. But I think ultimately I just want to kind of enjoy my maternity leave, really. Yeah. So we'll just see how it goes.
Play it by ear.
Yeah.
How about you, Nat? Obviously you did a little bit of training with me, like, and you carried on with Jenny as well, so you have been like doing stuff. But have you been back in a gym yet since you've been open?
No.
But
No, and that's
not like that matters or anything, I was just curious.
No,
like,
I really would like, that's what I miss the most, is the social element of the gym. And the last year having the lockdown, it's hard to motivate yourself to work out anyway, let alone in your front room with a 6-month-old banging on a jumperoo and like screeching. So I think for me,
and Rory climbing all over your face.
Yeah, I've got
He's
two.
a dog, by the way. That's not us.
Yeah, it's kind of, for me, it's finding the time, because you have the pressure of the bounce back, which there's so much on social media about accept it, and there is that element of, okay, I've just grown a baby, but you know, I'm 6 months now postpartum, and I've got the mum tum, and some days I'm like, yes, the body's incredible, I've grown a human, but other days I'm like, oh, I miss the you know, if I'd appreciated my pre-pregnant body,
Yeah.
like, if I could tell anyone that, like...
Yeah, but I suppose that's kind of a societal thing where, like, you know, most people are image conscious, like, no matter what kind of shape you're in, and, like, you know, you can't expect to be like that for, say, like 20 years and then just turn it off.
Yeah.
Like, so, you know, obviously after going through that, like, as much as you appreciate what you've done, and you know, you understand what your body's gone through, I suppose, like, it must be hard not to kind of like be self-conscious. That hiccup
Just hiccuping into the mic.
It's having the acceptance as well of, okay, like with the I find that coming as a mother, it's now you've got that spare half an hour, and it's, do I clean the house? Do I do the washing? Do I have some me time? And then you're tired, so then it's like, well, I've got to make myself do a workout. And I'm one of those, I feel like I need at least an hour to put aside.
Yeah.
And sometimes, like for the last week, I've done nothing because I haven't found that hour. And then I get the guilt of, but I want to get rid of my mum tum and I need some me time, but then I haven't got the time. So it's making the time as well. And I think I said to you on a walk once, I put way too much pressure on my body straight after birth. So
yeah, because you were like, it felt like 4 hours later you were climbing up Snowdon. Or something like that.
yeah, like the same day I was like, why am I hurting? Like, and because of having a home birth, there was no transition of leaving the house. So for me, I needed to get out the house because it was like cabin fever.
Okay.
But at the same time, you know, 24 hours postpartum, I thought that I could walk around the block.
I suppose like being in a hospital and then coming out of a hospital is like quite obviously a really clinical environment. It kind of, I don't know, it makes you feel like you're in a worse state maybe. I don't know. Like,
yeah, and I think, there is a lot of, you know, because of having him at home, there was that, oh, my body should be fine because I've stayed at home.
Yeah.
So when I got up and I said to James, right, we need to leave the house, but I could barely walk. And it was like, why can't I barely walk? Like, and then 6 weeks later, I was still like, why does this hurt to do this, and why does this hurt?
Yeah.
So I put far too much pressure on my body far too soon. I think for anyone, I know everyone's different, but I would say for anyone after a baby, even 6 weeks or more, just don't put the pressure on.
Yeah.
And it's really hard, and accepting that coming from, you know, years ago I used to compete, and coming from that background of always being a smaller body type as well, to suddenly not having the time to work out and being a bit bigger and knowing that I need to work out to get smaller. It's that vicious circle of something needs to give, but at the same time as well, I think it's important for mental health to also get that exercise in. So I mean, I'm in talks with my partner at the moment of, we need to have a day at least once a week where I have, you know, an hour of uninterrupted, no Rory, no Henry, and I can just go and I can work out.
Daddy daycare with Foggy.
Yep.
I think that would make sense. I suppose, like, I'll put that question back to you, Kirsten. Like, if you're comfortable answering it, like, how were you kind of, obviously being pregnant as well, kind of more the aesthetic, like feel about it? Like, I know, like, you've always focused on your performance when it comes to training, but like, how were you okay with, like, you know, were you hard on yourself with how you felt you looked, or anything like that?
I think actually the very beginning of pregnancy I felt the hardest because I felt like I just looked swollen and no one knew I was pregnant, and you couldn't really tell I was pregnant. It just looked like lockdown had hit me hard. And I think I found that you have to cry when but then actually I really enjoyed having a bump because it was growing something, and you know, there was all of a sudden this no pressure to like look slim in skin tight dresses. It was like, didn't really matter what you looked like because everyone knew you were pregnant and it was fine. I think postpartum, you see, I mean, luckily I followed enough people and I've got enough pregnant friends, to know that you don't just lose the bump. You look pregnant for a good week after giving birth.
Yeah.
And that's a bit of a shock. So looking at yourself in the mirror, straight afterwards is a bit daunting.
You're just expecting
to be
flat.
I think before my friends started having babies and before I started following people that post honest accounts of motherhood, that is what you see. Like, yeah, exactly. Like people coming out of hospital looking absolutely fine, but no. It's probably cooking. There we go. And since then it's been a very gradual process to get rid of the excess skin and stuff. And I'm still not, I'm not back to where I was. And I'm not sure I will be because I'm still breastfeeding. So in my head, one, it makes me extremely hungry. And two, I know that I need to eat enough to be able to feed her and stuff. So it is weighing up. Like I still have the days where I put something on, especially something that used to fit me pre-pregnancy, and I'm like, oh, it looks terrible, or I hate the fact that my skin now hangs over the edge, or and then other days I'm just really appreciative for the fact that I can, look after a baby and still come into the gym and do something, and then go for a walk and, and survive on far less sleep than I ever have done before. It just, really does fluctuate up and down just depending on the day.
Yeah.
How about you, Tash? Obviously, you're still in the pregnancy phase. How have you found that?
Yeah, I think it's definitely getting, like Kirsten said, it's definitely getting easier now that I have a bump. So it's like I did struggle at the beginning, and I think it's because we were in lockdown as well. So I wasn't getting out as much. I haven't been to work for a year, so I don't walk around the office and stuff like that. So and I definitely felt like my sort of legs and bum filled out really early on, so it just kind of looked like I put on loads of weight, but again, I wasn't really seeing anyone, so it didn't really matter, but I definitely feel a lot better now, that it's obviously really obvious that I'm pregnant. You just kind of definitely feel swollen at the start, and you're just I mean, the masks are really good because it hides the double chin, so it's always helpful.
So how was obviously there's the phrase eating for two. How was all the eating when you were pregnant and stuff like that?
See, I couldn't eat, so
No?
it was almost like I was always full. So there were parts of my pregnancy where we weren't in lockdown, so we could go for a meal.
Yeah.
And I would have quarter of it, and I'd be full.
Oh wow!
And it was frustrating for me.
But did you feel sustained? You felt full?
Yeah.
Oh really? Okay.
And I become a grazer, so I would just eat little and often all day long.
Yeah.
And then after pregnancy, so this is where I can tell that I can eat more now, because I could never dust off a Molly's. I would only
Molly's Diner?
Yeah.
Oh, that place is decent.
And I would only ever be able to eat the burger.
Yeah.
But now I can eat the burger and the chips. But I can never do that. I only eat half the burger when I was pregnant.
Oh, really?
So that whole saying eating for two, I definitely couldn't take advantage of it, because I could eat half a burger and be full.
So one of the positives you didn't get, basically.
Yeah, I got it afterwards, but then that's oh great.
How about you, Tash?
Yeah, I don't really eat.
Well, you stopped eating after 1 o'clock.
Yeah. So
I now have beans on toast.
Yeah, exactly. Yeah, Zak doesn't get very good dinners anymore.
I do cook my dinners, by the way, but we stopped our gusto order.
So I don't really eat very much anymore. If we're going out for dinner, I have to prepare for it the whole day and not eat. So I'll have something for breakfast and then I won't eat again until we go for dinner.
A lot of that's down to you getting heartburn, isn't it?
Yeah, so I've got really bad heartburn. I get really bad reflux. So if I eat too late, I can't lie down and go to sleep, and I'd rather sleep. Not something I ever thought I'd have to choose between eating or sleeping. And I'll never ever say again that I wish I could eat less, because it's horrible. And I think as well, I kind of envisaged that I'd be really healthy, and I'd be I'm going to eat loads of fruit and veg and stuff, and I'd pretty much eat like a student again. So all I want to eat is pasta, super noodles, cereal, eat a lot of cereal. I don't have a very good diet, and it's not very, but if I eat certain stuff, I'm sick, so just eat what I can.
So how about you, Kirsten? Because I think, did you suffer a bit of heartburn as well?
Yeah, not as bad as Tash, but it definitely definitely played a part in kind of making your food decisions for you, because you just avoided spicy food and again avoided big meals. I started grazing throughout. I mean, I definitely didn't lose my appetite completely. I don't think anything would ever stop me eating, but it did. Yeah, I crave different things as well. So it was the bland things. It was like
Beige.
Yeah.
bread. It was, chicken and bacon and mayo sandwich fillers. I could have gone through a tub of those a day.
Tubs?
Yes,
Yeah.
they were the best thing ever. But yeah, I mean, I didn't eat. It didn't eat for two, I don't think, but it wasn't necessarily healthy, and it was you couldn't binge eat like previously could have done on an evening. But it wasn't.
No massive bags of chocolate anymore. Well, sometimes, but then I regret it after.
Yeah, exactly.
So I've got 2 more questions. One of them is like your goals, but just strictly related to training. And like you could turn around and say, well, I don't give a fuck about training anymore. But it's up to you. So like, let's say like in the next 6 months, how would you see your training going? Like in the gym or out of the gym at home, whatever.
So I would love to get back in the gym.
Yeah.
And I think there's a lot of elements that I feel it will take to get over that, because I've got, again with lockdown, I've got so comfortable with working out on my own in my garden or my front room. I think the anxieties that will come with entering a gym again, it's almost like that full circle of when you've never been to a gym and you're walking into a gym for the first time.
I suppose what's quite positive about that is a lot of people you were going to the gym with have just had kids, like Sal and Lucy. So that could be a positive.
There's been a gym baby boom.
There has.
Yeah, so that's my goal, is to kind of get into a gym more for the social element, but to enjoy fitness again like I did before.
Cool.
That's my goal.
Sweet. What about you, Tash? Obviously, it hasn't happened yet, but
just kind of similar really, just to be able to try and get back, even if it's like a different, I can envisage that it'll be like 8 p.m. at night, times in the day. I think personally, and I don't care how long it takes me, but I want to be able to do a pull-up again, like that kind of thing. Like I'm not really bothered about how much I can lift, but I like the gymnastic side of things. So I think a goal for me will be to be able to do a straight pull-up and see where we go from there.
Cool. What about you, Kirsten? Because I feel like me and Bing have already lined you up for about 10 competitions in our heads.
Yeah. I do want to get back to. I want to compete this year, later this year, in a team setting, not individually, because I don't really enjoy individual comps. And I want to know that I'm going into a competition and I'm not going to let the team down. So, be able to. I'm still going to have weaknesses, probably the same weaknesses before, so fitness.
Running.
I bought a running buggy actually, so my one of my goals is to get out running. Instead of a dog walk, I'm going to take them both out on a little run and to try and enjoy it, not put pressure on with running.
Yeah, and you can just take your time and enjoy like the scenery and stuff like that.
I'm not going for a personal best. But I want to get back to kind of a similar state of training to where I was before, so that I can compete and not feel I'm letting myself down or anyone else down. But realistically, I'm not going to be getting in as frequently as I was before, and I'm probably not going to exceed my previous numbers in either gymnastics or lifting. But to get somewhere close to that would be good.
So on those numbers, is there, because Tash said she would really like to be able to do a pull up again? Is there something you desperately want to be able to do, and you're worried about losing, like muscle ups or a certain weight you lifted kind of thing?
Actually, the gymnastics has probably come back.
Yeah, because I see you
quicker.
doing stuff earlier.
It's quicker than I expected, and my strength is way down. So I do want to get kind of my snatch back up to high 60s if I can. I've been on that number for years anyway, so I just want to get back to that.
You've hit 75.
I've hit 73. I've come close to 75 quite a few times. But be consistent around the high 60s, so that if I, a max snatch came up in a comp at 70 would be, possible. Same with a clean and jerk, get it towards the 90s. And then, with gymnastics, just feel comfortable, on the rings, bar muscle ups. Bar muscle ups, I think I found the hardest pre-pregnancy anyway, so that's the kind of one I'm most worried about. But be able to string together a few of those, enough to get me through any event.
That's cool. Cool. So final one, and this is for all those lonely listeners out there who are pregnant. I'm sure there's loads of them. What advice would you give someone, especially someone who goes to the gym regularly, and from your point of view after what you've experienced in that, like what advice would you give someone?
Listen to your body
Yeah.
would be, and accept that. I think there's so much stuff online about the difference in, say, surgery and having a baby. And so for me, I think it's either however you give birth, it's a huge tax on your body.
Yeah.
And I don't think there's enough recognition of that. So it's to recognise that your body does go through a trauma however you give birth, and to accept that you've got to slow down and just, the pressure of enjoy your little bubble, and you don't have to get back to it so soon. Like, just wait and relax. Because I didn't. Like, as I say, before 6 weeks, I was like, why can I only walk X amount? Why can't I, squat this or do that?
Yeah.
And it would just be to step back and kind of say, you'll never get those newborn moments again.
Yeah, just appreciate it.
Yeah, you can wait and get on a bar or do a workout, but just, enjoy that little bubble, and the fitness and stuff will come.
Yeah.
You just got to wait for your body to catch up with.
Tash, from your experience so far?
Yeah, so from a pregnancy point of view, I think for me, and I was saying this to you the other day, like, I've really enjoyed signing up for something that I had never done before I was pregnant. And I'm not saying start running or doing anything like super taxing, but for me, starting Pilates was really good because it was something I'd never done before. So
Probably never would have done it.
Yeah, and I probably know. So I think because I couldn't compare it to anything else, so this is all I know of Pilates, and I've really, really enjoyed it. Whereas doing prenatal yoga or trying to do CrossFit or that kind of workout whilst pregnant, I've been comparing it to my previous experiences, so it's like, it's not the same, or it's more boring, or blah blah blah. Whereas so whether it's kind of Pilates or swimming or yoga that you've never done before, you have nothing to compare it to, so it's just really enjoyable. Like, I've really liked it. So I would say try and do something a little bit different, not necessarily anything hugely taxing on your body, but and I think Pilates has been really good as well. She's really good at kind of like working pregnancy or post-pregnancy situations into the workout. So we'll do a movement and she'll be like, this is how you'll pick your baby up if you've had a C-section, or if you've, that kind of thing. And it's just, I've just found it really useful, really. So definitely try and do something a bit different.
And you, Kirsten?
I think mine would be, don't assume that your pregnancy or your journey is going to be the same as anyone else's. Do your own research and make your decisions for yourself. So, I had people, when I was training and posting videos during pregnancy, people be like, should you be lifting that? Should you be doing that? Other people then really supporting you. But it's down to the individual. For some people, that is going to be too much. For some people, it's absolutely fine.
I suppose a lot of that's like relative to what you were doing before.
Exactly.
Well.
And, what works for me, even being a gym, even comparing two gym goers, isn't going to be the same. Certain movements are going to work for one and not for the other. So, do your research, but your own body, trust your gut instinct, and don't necessarily compare yourself to others and assume that you're going to be able to do or not do the same things as they are. So it literally changes day to day, week to week, but everyone is different and their journeys are completely different, pre and post babies. So
sweet. I think we'll end it on that. Thank you for doing that. I know you probably thought I was the right weirdo when I asked you, but thank you so much. And that is TAC Talk today.